Hi, good afternoon, everyone. So the next session is about boosting health accountability mechanisms, and I'd like to. Am I sitting on the right? Okay, and I'd like to invite our panelists for today. We have Nina Schwalbe, principal of Spark Street Advisors, Professor Lawrence Gostin, Distinguished Professor of Law at Georgetown University and Director of WHO's Collaborating Center on Global Health Law, and of course, Ms. Blessina Kumar, CEO of the Global Coalition of TB Advocates. All right. Well, thank you all for being here amid a very busy UN General Assembly. But I'm just really happy because these are people I really speak to. These are really great experts, in their fields, and so I'm really happy to be able to see them in person because I'm mostly chat with them and stuff. But yeah, so this UN General Assembly, countries are again making a list of commitments to global health, but also when we talk about pandemic preparedness, it's beyond just health. So a lot of commitments in that. But how can there be more accountability in these commitments? How can governments be held more accountable for these commitments they're making and will be making? So I want to start maybe very briefly, just to kick off this conversation, to ask each of you, why are monitoring and accountability mechanisms so important, especially with this week's high-level meetings? Nina, you want to start?
Sure. So thank you to Devex for inviting all of us, and to Jenny for your excellent reporting on an issue that too few people want to cover, which is pandemic preparedness and response. It's as if it didn't happen. I think the bottom line for me is that a piece of paper is like a treatise or whatever. They're just a piece of paper unless there's monitoring and accountability associated with it. And it's super easy to promise things and much more difficult to deliver on them. I'm not quite at the point of what doesn't get monitored doesn't get done, but a little bit. So the fact that they just adopted a political declaration, which nobody's even going to look at for 3 years, is for me a case in point of why we need official monitoring and accountability mechanisms.
Yeah, I mean, I couldn't agree more. Obviously, if something, if you have to make a commitment and it's just on paper, it's useless. It's got to have impact on the ground. And we're going to have in our talk, Jenny, a lot of conversation about the kinds of mechanisms, carrots and sticks that we're going to need. I've got a whole list myself. I'm sure the other panelists do as well. But if you look at existing treaties, they're notable for their lack of compliance. You don't have, for many of them, except for the world, the WTO, you don't really have dispute mechanisms or anything like that. But of course, in trade, we do. But in health, it's very, very rare. The biggest example of that, of course, is the international health regulations, which have been the governing instrument for the reporting response and to public health emergencies of international concern. And there's been widespread lack of compliance. I'll just give you one example, which to me, I think is jaw-dropping, and you'll all know about it, which is when South Africa quickly reported the Omicron variant, sequenced its genome and reported it transparently to the world, rather than getting an incentive, funding, even a pat on the back. They got travel restrictions targeted to Southern Africa. That's just one example of the lack of compliance with the international health regulations and with other treaties.
Mm-hmm.
Thank you very much for inviting me. We in TB tend to stick to our own events, so this is really refreshing. And listening to the panelists speak about poverty elimination, food security, refugees, all so relevant in the TB for the TB response. So for any commitments to become a reality, I'm all about working with people affected by TB. So it comes from that perspective. So for me, how do the commitments that are made here this week become a reality? How will it add to lessening my burden, my suffering, if I'm living in a slum in South Africa or in India or faraway PNG. There needs to be an accountability mechanism. If we look at 2018 high-level meeting on TB, we had a good political declaration, great targets. I'm very sorry to say we haven't reached even one of them beyond 50%. Some we are as low as 5%. So without robust accountability mechanisms, all the talks of this week are going to be completely meaningless.
That's so true. I think everyone's just looking like, okay, there's now these commitments. What's going to happen next? But let me go back to Nina. Um, you know, I hope you're no longer depressed.
No, no, no. I'm in
What monitoring and accountability measures are in place to ensure governments walk the talk on their pandemic preparedness commitments?
Yeah. So first of all, we don't really have any yet. Yesterday was supposed to be a strong start. It was a bit of a limp start, but we are hopeful now. We do have the IHR as well, that the treaty, which is being negotiated currently in Geneva, will be a strong commitment. I think the problem right now is that we don't have great monitoring or accountability systems around these, including the IHR, which is essentially peer and self-reporting. So a lot of what is around the commitments in health are peer reporting and self-reporting. Self-reporting has its limits. It's late, it's not complete, it might be inaccurate. I think the good news is, and the positive news is, there's a lot of examples. Professor Gostin mentioned one. The ILO has a mechanism for whistleblowing. The human rights has a whole shadow mechanism for reporting where civil society can engage. The atomic energy treaties, you can actually do march-in rights to country. So there are examples of where there are mechanisms to be able to independently monitor accountability. I think the trick is that and we'll talk later about this, is the idea of independence. And in order for monitoring to be effective, and a lot of research has shown this, it really has to be independent. And that means independent from political influence. And I think with the treaty, we're going to need a system which allows for verification of self-state reporting, which includes a wide range of stakeholders, civil society first and foremost. It's backed by our political leaders. And that's why I'm a big fan of this idea of a threats council and a high-level threats council, which is made up of political leadership, which is ultimately accountable for the state of our world. I often feel like I'm like talking to Star Trek when I talk about this stuff, but this idea of holding our political leadership accountable, to have on-site investigational power. So if country X says, oh, we don't have that, there is a potential to go in and check and verify that it's autonomous. We all know, I mean, I don't know as much about many of the sectors and the things we've heard today, but we do have sort of a lack of autonomy in our world. There's a lot of political dependencies and interdependencies, which don't really make people super independent. And the other part is this necessity to have a carrot and a stick approach. So states should be rewarded for good behavior, and there should be incentives in place to help them get where they're going if they behave well. And also something we can learn a bit from the human rights community is this idea of, if they're not compliant, is there a way to name and shame them? So I think we have a lot of work to go on this in health, and Professor Gostin's done a lot of work also on the framework tobacco on convention. And I love the way that that's always held up as such a great example, because at least in my country, everybody's still smoking.
It's not good.
Well, I'm going to go back to Professor Gostin and some of the things he mentioned. But Blessy, you mentioned earlier, all commitments, back in 2018, we've not really reached on TB. So how can we improve, the accountability for these new commitments that governments are making on Friday?
Thank you. So the question is, who is able to, or who holds who accountable? It is the community, it's the people that can hold governments accountable. Global entities like World Health Organization, Global Fund, government aid agencies actually cannot hold governments accountable. So I think it'll be the people,
why is that?
And empowering people is the most important thing.
Why can't they?
It's political, isn't it? I mean, you are in a country at the request of the government. you are governed by member states. So it would take a lot. I mean, I'm not saying it can't be done. It would take a lot for someone to actually say to a member state, I'm sorry, we're not progressing well in this particular area. We need to do better. But sadly, in TB, we haven't reached that. And also, the fear is that the civil society also begins to compromise. I think that's the danger. So we need to protect that voice of dissent. We need to protect, the seats at the table. We need to provide those seats. And if there is no seat, dismantle that table, but continue to keep raising the voice of people who are dying. Because TB is fully curable, but in 2020, we had 10.5 million people who developed TB, and 1.5 million died. That's mind blowing from a disease, an epidemic that is completely curable. And it shouldn't be acceptable. It should really be making us angry. But unfortunately, we're not there yet, I guess.
Professor Gostin, so today actually is the high level meeting on universal health coverage. And we've been hearing universal health coverage there. I think for so long, everyone's just saying, we're going to reach this. This is the goal. Um, this week, WHO and the World Bank just published their UHC monitoring report, where we're learning that more than half, or 4.5 billion of the population, were not fully covered by essential health services in 2021. That's 4.5 billion people. So I guess how helpful, first of all, is this monitoring report? And what other mechanisms are out there when we're trying to hold governments to their promises of achieving UHC? And what do you think is missing, or where things can be improved?
Yeah, I mean, there's a constant theme among all four of us, which is that we set goals, we set targets, whether it's in tuberculosis, the SDGs, universal health coverage, and we never meet them. And how can we meet them? Remember, UHC goes back to Alma Ata and the primary care declaration. We've never really come even close to that. And the monitoring shows it. We're here in the United States, among the richest countries in the world. A lot of people don't get coverage, including migrants. And it's true all over the world. So what are the possible mechanisms? I'm just going to rattle them off. And most of them, they've been eloquently stated already. One is, granular indicators. Disaggregated data that really can make things transparent. A second is deep scorecards, that really announce the kinds of weaknesses we have. Dispute settlement and incentives in funding. I think the carrots and sticks is really important. We actually have to have that kind of incentives. And so if you look at what you talked about, the independent evaluations of UHC or the IHR core capacities, it's self-evaluation. We really don't have much. And I want to end with the civil society part because, the best model for change is AIDS. In my mind, AIDS changed the world. And it was through bottom-up social mobilization. So I think civil society empowerment, funding civil society, but a combination of all of these is really necessary. And I think we can do it, but we do need the political will.
Nia, do you have where do you think opportunities here for when we talk about pandemic preparedness? What are some opportunities for change, or what initiatives are out there that we can build on to be able to hold governments accountable?
Yeah, I think there are a lot of opportunities for change, and I see Joy Pumafi in the room from the GPMB, and she's been a big champion of independent monitoring. And I think what we're proposing for the treaty itself is an independent committee, and this isn't a committee that redoes what WHO does. It doesn't look at disease analysis. What it does is it says, are states reporting against the treaty? Is their report timely? Is it complete? And is it accurate? Timely and complete, one can look at without any third party. And on the accuracy, are there other credible sources of information which suggest that what's in the report against the treaty is accurate? Civil society voices or other, following a lot of the shadow reporting. I think the trick that we're going to have to, the thing we're going to have to get over is really holding ourselves accountable vis-a-vis what does it mean to be independent. And what we mean by independence, and we've looked at a lot of measures in a report that we should have out in the next couple of weeks, is technical independence. Can you say what you want to say based on the evidence that you find? Operational independence. Can you operate? Can you visit a country? Can you travel? Can you do things that make you operationally independent as a committee? Are you politically independent? Either from, you were appointed by somebody and you have to say whatever it is that sort of your boss wants. And are you financially independent without strings attached to the money? So we think there are real opportunities for the treaty to be able to put in place an independent monitoring committee. And we're enthusiastic about that.
Leslie, do you have anything to add in terms of, in the TB space?
Yes, in terms of opportunities, it depends on the willingness to shift power. If we look at where does the power lie right now, very little power at the bottom, where it is the affected communities, and especially in TB. And I think as long as TB remains medicalized and people suffering from TB remain passive recipients of care, or looked at as passive recipients of care, it's not going to change. We need to recognize people affected by the diseases who have the lived experience as valuable partners in the response. Create the space, invest, and ensure the investment is actually rightly used to change the status quo. We are great at monitoring. We know exactly what the progress has been from 2018 till now. We have the percentages, the numbers. I think what we need to do better is in terms of accountability. Holding people accountable who are responsible. Otherwise, it'll be another HLM, another, talk about targets and how we've reached so little, and the cycle will go on and on. It needs to break. And I think the time is right for us to actually break that and say, enough is enough. We need accountability from people who have committed and who have promised to make a difference. And we will not rest until that happens.
Dr. Gostin, I give you the last word, but where do you think things can change? And also you mentioned, the importance of earlier about, the whole carrots and stick thing. I think, how can that be more effective?
Well, one of the things we haven't talked about, of course, are funding mechanisms. And funding mechanisms, are important in and of themselves, but they're also can be important as incentives for countries to do the right thing. So I think working on those kinds of areas would be good. Let me just end with just a little bright hope, because it's very easy to just get awfully discouraged because of all the goals we've set and all the failures we've had. But in the IHR, you've got Global North and Global South, with one on calling an implementation committee, the other compliance committee. And we're trying to, one's from the African Union, and really trying to have a meeting of minds. The other thing we haven't talked about is accountability for equity. Equity is the thing that we failed most at. We've always done since, tuberculosis, Ebola, Zika, you name it. And COVID-19 was the classic example of just the utter unconscionable failure of us to be fair. And so to have those equity mechanisms and be accountable for them, there is a lack of trust in Geneva now among the negotiators, North and South. And this is at the heart of it. And we can do it with some financial incentives, as long as real clear commitments to equitable allocation and diversified manufacturing of vaccines and therapeutics.
You mentioned Geneva, so I just want to build on that. How can the pandemic treaty discussions help?
Me? How can the pandemic treaties help? Well, it's very clear that I've got so much to say about it.
But maybe just one.
Just one.
Yeah.
I mean, in the current draft, there are no accountability mechanisms. Basically, what they do is they say, let's just punt that off, kick the can down the road. The conference of parties will deal with it. That's nonsense. You can't do that. And there are clear mechanisms we can use. And we've stated what they are. And we've got to choose a suite of them and actually have binding commitments in the treaty to do that.
Well, thank you so much to our panelists, really for this insightful conversation. And hopefully, the high-level meetings will not just be a paper, but
All right. Thank you, Jenny.
Thank you.